Hello, everyone. This is Shanda J, your BCBA, and this is a YouTube channel that focuses solely on adult services. One of the main things we like to prioritize is caregiver guidance, advocating that we focus more on interdependence when it comes to the individuals we support, and then also to dismantling ableism culture. Now, when it comes to my YouTube channel, I don't just invite anybody. Typically, all the speakers I have that join us contribute in some capacity, giving us knowledge and wisdom on how we can support the adult population better. Today, I have, and I'm honored to announce some distinguished leaders. Now, this is part two of our first discussion. The leaders I have with us, they are currently collaborating on an upcoming definitive industry resource, comprehensive behavior analytic supervision. Just in case you missed the first part, today is part two of the discussion. Advancing supervision, shaping tomorrow's leaders, their project challenges the field to look beyond compliance and hours, but focusing more on clinical reasoning, cultural responsiveness, and compassionate care. And one thing I've never heard of up until my first interview was restorative supervision. Never heard of that. With that being said, today our guests are Michael Weinberg, a leader in professional development and adult services, specializing in clinical case formulation, competency, and strengthening supervision frameworks. Then we have Timothy Templin. And if I mispronounce your name in any capacity, please let me know. Timothy is an expert bridging behavior analysis, counseling, and forensic psychology, offering deep insights into navigating complex legal and clinical environments. And then we have Ms. Valerie Pascal. Did I say that right? Pascal?
Pascale.
Oh, Pascale. Okay, there we go. Pascale. She's a doctoral candidate, director of ABA and disability in Salerno. Did I pronounce that right? Salerno, Italy, and winner of the 2024 SABA International Award for her groundbreaking behavior analysis in prison project. She brings a massive interdisciplinary background spanning neuroscience, law, and OBM. So thank you everybody so much for being in the room, wanting to do this together. I mean, it's definitely much needed. So before we go into it, um, I do have a question, and I love if you guys can, for our listeners who may be listening for the first time, maybe they didn't get to hear part one, could you just give our listeners a little bit of background information of what is comprehensive behavior analytics supervision? What is the book going to mostly be about, and how can it support BCBAs supporting other BCBAs and clinicians?
Well, I can start off if you all would like that. And so the primary focus of this book is that it is going to be a very comprehensive review of more than 50 years of research on supervision. And we go back a ways because 50 years ago, there wasn't much on behavior analytic supervision. There was some, but we go outside of the field a bit to other areas and pull that into uh, our supervision approaches and model to bring it in line with behavior analytic methodologies, but we incorporate others as well. And also, this is very broad based. We call it comprehensive because we are not specific to autism. So, as far as we're aware of the current books that are out there, I won't mention names or anything on behavioral supervision, it focuses on autism and specific processes and steps that we see from organizations, such as the BACB, for instance. So we go well beyond that to any kind of behavior problem. Remember, Sturdo said that behavioral principles apply to all living organisms. So why is it focused on autism? We don't need to. We actually should be focusing on any type of behavior problem or issue or concern that is presented and be able to provide behavior analysts with proper supervision and oversight on how to address those kinds of problems as well. In that regard, this is a very different kind of book and approach that we don't see anywhere else that we know of in supervision. So we go well beyond that to any kind of problem, childhood problems, adolescent issues. It could be ADHD, it could be conduct disorder, it can be any kind of issue, anxiety or stress, or children who've been maybe abused and neglected, or other issues. So it doesn't have to be that. And the other thing is that with that, we have developed our own model for our supervision that is a stage by stage, step-by-step process based on the behavior analytic model itself. Going back to where Wolf going to their child development model they developed at Kansas, but we're applying it to development of supervisors of the supervisor using that step-by-step stage model. But we also want to address the issue of burnout. Right now, we're seeing 30 to 40% dropout rates in the field. Analysis after only a few years in, for a variety of reasons. We have some approaches that we would hopefully help affect that problem to get people back in, motivated, invested. When it comes back to proper training, a lot of it has to do with addressing difficult behaviors. We want to make sure that supervisors are training their supervisees to be able to handle those kind of difficult situations and how to deal with the stress as well, using things like maybe relaxation, some of the approaches, and that's going to be restorative model. So at that point in our process. So those are the major areas and reasons for which our approach and our book is very different than any other book out there that he back to.
Thank you. Thank you. And I want to, because I am proud to say, um, between Mike and Timothy, you guys have some experience with the adult population. And Valerie, if you do, definitely let me know. I don't want to count you out. But studies have shown that by the year 2030, there is going to be an abundance of ABA providers working specifically for the adult population because the need is gradually increasing. Just in case you're just now watching, this is 2026. So in a couple more years, by 2030, there's going to be an ABA provider for adult services on every corner, like the gas station. And I just say that to be funny because right now, it's depending on what state you're in. There's not a lot of ABA providers for adults. For some states, it's an abundance. For some states it's scarce. So with that, those statistics and those numbers, how is this book going to be beneficial to that BCBA who is consulting with somebody who is possibly working with adult services for the first time, or maybe somebody who's green? In case you don't know what green means somebody who's like newly minted, like they're new, maybe it's my first year being a BCBA. So how can this resource really help that BCBA that's supporting the adult population?
Well, there are a few issues that I'll go back to what you really spoke about. And, of course, I've worked with adult populations since 1975. Okay, so I've been in this for a while in various residential programs, and more recently, organization I was with, we had 70 group homes for adults, 70 across the state where we're in. So there's quite a bit out there in these in many states. And so adult services has been focused on unity, community-based services. We got institutions some 30, 40 years ago, which is a good thing. Now we're in a situation where a threat for adult funding for adult services altogether uh, because of some recent governmental it, changes that occurred, such as possibly going to Supreme Court in Olmstead Act. We don't know what that is. You can look that up, but that's the class action suit said that adults with developmental or intellectual disabilities or autism disabilities have the right to uh, there's a movement and this is the threat. So now we have more analysts who need to get trained in it. Remember, these ABA programs that are supported by the BSB and now need an ABAI or innovation focus largely on children. That's where the money has been. That's where the focus and emphasis has been. Children with autism, young children with autism, particularly. Lots of study was on very early intervention. And we have nothing to compare it to with regard to adult students. Nothing that sort of exists. Some are out there right now trying to change that focus, like John Lucio, who's been developing adult training models, and so he's been doing a great job going out there, getting the word out. But these programs need to start focusing, changing it at the university level. I'm dean of a college program, we have a master's that we're developing in applied analysis, and we were previously approved in our BCS program. But those programs need to start including more adults with disability, because as you say, shift in population as they get older. We've seen fewer children. What's going to left is going to balloon to a lot of adults who are going to these services, need care with no funding for it. Really, insurance won't cover it. Medicaid won't cover the adults. There is some afoot, some professional organizations to try to make that happen legally. Organizations like CASP, for example, we're trying to move forward with that to make sure adults are getting services in care and remain in the community. So there needs to be multifaceted approach. So in our book is not specific, as I said, not specific to autism. It's not specific to children. It's specific to supervision, training, supervisors. We provide this of the legal issue, we provide this of age. It provides a comprehensive model that can be used with any type of client individual that you are working with or that comes to you and presented with services so that you be prepared. That's your address for folks. This will help prepare you to properly address adult issues and adult needs, because they're different. Their issues and needs are very different than a 2-year-old child, right? How to be included in the community, how to help look at their preferences, my preference, what do they want? Their choice is important and critical. So the approaches have to be very different. And so you have to have behavioral analysts who are trained in understanding that and how to do that. I trained lots of behavioral analysts over the years and working with adults, working within the context of various regulations and funding and how to help support them in the community. And that could be just as simple as maybe they need to work on self-care skills. Maybe they need to get more recreational activities. What are we going to do? What kind of things do they enjoy? With acknowledgement and acceptance by the community. That's another huge piece of this. Going out there, these folks have the right to be out here. They should be included in activities, and we are saying that together. It is for those individuals we serve, and we think that it's better for the community as a whole, for much for inclusiveness. So this is what we want to strive for. But we think we'll offer a model to train clinicians and behavioralists, and no matter what the population, who they serve, it has to drill down and focus on that formulation for that individual. So we very much so have an early phase of teaching case formulation, which we think is really missing from a lot of the ABA programs out there, training programs. And That's really where it starts. But right now, we're going to have this as part of the supervisory model because a lot of it boils down to supervision. And that's where it's important to advocate formulation. We have tons of practices and practice exercises and vignettes, how to solve them in different types of cases to teach case formulation and to teach the supervisors how to teach upon case case formulation. Because that's what it's all about. And again, it depends on who your client is. The needs are as to how you formulate that case, what kind of outcomes you're going to try to achieve and work on with the individual and others around them, family, it could be guardians, it could be others involved, whoever it may be. How to develop that person from that case formulation to me is a really important issue, and what I think is often missing out of graduate programs, including analysis. Hopefully, we'll see things improve over there. We have our model well, because everyone has to go out there and get their 2,000 hours of supervised experience, and you want qualified, competent, ethical supervisor. And that's what we hope to provide. Hope to provide additional training in this for certification for the qualities. It doesn't exist right now. I think it's needed.
And if I can follow up on that, I am not one of the authors of the book. I am a promoter of it. I have interviewed Mike. I've interviewed Valeria on my own podcast, Criminal Behaviorology, and of course, being a BCBA, being in the field, I've had my own experience with supervision, and I can say early on, it felt. Well, it was a matter of getting a supervisor and just filling out the tracking, whatever we wanted to call it, just getting the boxes checked. And when I became a supervisor myself, it from the other side of it, it wasn't so comfortable either. And that's why I really like the book that these fine authors have put together, that it is behavior analytic interventions on supervisors and supervision itself, using these same principles to have supervision be studied and the behavior analytic concepts are implemented so that we can actually make supervision a very successful, productive, if you will, function-based procedure, so that those that are supervised will get the best benefit from it. I've worked in adult services, I still do. In forensics, I've done some work on competency to stand trial, in adult community services. And this is, by the way, of course, not separate from autism. I've got cases now where people have had services before, and now they've gotten too old to get the autism services. So now they're coming to the local community mental health for services, and the people that they're going to do not necessarily have the training, the supervision, the resources to treat them. Working with adults, you're going to need this kind of assistance on supervision, and viewing it as a behavior analytic problem to be solved would be my strongest promotion of it. And I'll let the actual authors speak more to that of the content of the book.
I would love to add something to what Mike and Tim said, because my background start with children, but right now for several years I work with adults. And Mike mentioned John Gershaw. John Gershaw is one of my partner in work with adults, so we have a lot of work together. And I'm not one of the authors, but I'm very glad to be part of this discussion because it's very helpful considering what Mike said regarding is beyond autism. We have to think about when we serve adults, and I come from another country, another culture, another system. So where is not the BCBA, because in my country the certification has no legal value, but we follow the certification requirement in our master degree because it's important to have a basic knowledge to talk in a so complex environment. And so when you think about adults, you have to think about psychiatric occurrence, and you have to think about psychopharmacology. And I also presented in the last EPA, that is an European Psychiatric Association, a behavior analytic work on behavior relaxation training on caregivers, because the environment affect their son. So this book can guide everyone, because it's not just a list of procedures. It's a way to understanding better the basic knowledge of the science and adapt to the situation you have to work on in everyday practice. And they push you to think is first the clinical reason and the decision making you are taking, if it's correct or not, based on the population, based on the environment, on the situation. So I think it's not just a book that guides you through the procedure to the basic knowledge, but push you also to understanding better how to make decision in your everyday practice. And this is a big value. It's not like you read a book and you can have a comprehensive idea. It's something to reflect on that can add value to your knowledge, man. That's very important.
And it sounds like it goes beyond just supervising a BCBA. It sounds like it's just giving you practical skills to just supervising others. And when it comes to the adult context, you're supervising, I'm sorry, the caregivers who could be loved ones, mom, dad, whoever is just mainly supporting the person at that time, or it could be support staff where it's more informal, where these individuals are paid staff to work with the individual day in and day out. So it sounds like it goes beyond just the typical, oh, I'm supervising a BCBA. This is just a task list item we actually have on the sixth edition task list, and also on our ethics code, providing quality supervision. Something I'm starting to do in my interviews is I want to start doing case studies. So that way, my listeners and viewers can actually get real time examples of, based on the speaker's area expertise, how a certain case should be solved based on the topic of discussion. Because it's one thing for us to just kind of utilize this as a platform to talk about the science and to talk about the resources, but it's another thing when you go to the capacity of application, because application promotes generalization depending on how often you apply it. But I'm not going to go down that rabbit hole. Okay, all right. So I have a case study. We have Joshua, and this is not based on a real person. This is a pretend scenario. Joshua is a newly certified BCBA who completed all fieldwork hours under one supervisor. After passing the exam and beginning work in adult services, Jordan realizes that the certification did not fully prepare him for the complex clinical decisions, interdisciplinary collaboration, autonomy, ethics, or other real world challenges. After learning about comprehensive behavior analytic supervision, Joshua recognizes the need to expand beyond one supervisor's perspective. So, my question to you is, what advice would you give Joshua? Like, where should he start when it comes to just diversifying his experience, identifying competency gaps, finding mentorship, strengthening clinical judgment, even developing his own personal identity as a BCBA? I know that was a whole lot, but the meat of the conversation is, and this is pretty common, where a BCBA, in this context, his name is Josh, he's only had one BCBA supervisor. And now that he's in adult services and he's in the real world, he's realizing, wow, all those hours I accumulated under that one person, it did not prepare me for the real world. So, what advice would you give Joshua?
We'd like to keep it out. I could probably, get started here with it. Then have something, but or should probably be seeking others. And we advocate for that in the book as well, that people should be getting different experience and different supervisors and different setting issues to give them a breadth of experience. But it also boils down to, as supervisor, how trained and qualified is that supervisor that supervised Joshua. And here's the question we can throw. Will we be able to pretend to know that from your scenario, since it's a made up one? However, by and large, I guess is that the supervisor themselves is probably not adequate training or prepared to provide supervision to train the supervisee in the breadth of areas of knowledge that they can have, skills that they have to be effective. Not putting anything right down or criticizing anyone. I think it's just a matter of their private training. BACB never really had a very comprehensive model the training of supervisors. They had some bullet points, here are the things you should do, but there was never a comprehensive training, and a lot of it's not very well overseen or managed by anybody. It's all up to the individual supervisor, and it's all up to if they're working in an organization, that organization, but they're too busy seeing their clients to see what that person is doing as a supervisor. I provided supervision as an independent practitioner in my own company for a lot of years because people couldn't find supervisors. They can't even find them, which is another problem we're working on right now as well, because BACD hasn't really tried to help students get supervised experience, but not really necessarily what they should be doing, actually. But no one else has stepped up, so I'm stepping up on that. But there has to be standards. So if you have a student in one place and want to get supervised experience, the supervisor who's willing to supervise that agency, or if they're sole practitioner, has to meet our standards. They have to know our model. They have to be trained and competent. So we're developing that competency training model for the supervisors themselves. It all goes back to that. And so even if that's Josh seeks other supervisors, how do we know they're properly trained and qualified to provide supervision either? They just check them off on boxes. There's the problem that we're seeing in the field, and this is the gap that we're trying to fill in and close with this book and the next steps that are going to come out of it, which is qualified, competent supervisors who can train supervisees on how to address the problems, issues, and needs, more serious level behaviors. They're doing some serious complex behavior problems. They're not getting trained and so law. Supervisors, as Tim said, are just checking the boxes. Yeah, you came in, we sat, we had a chat. That's nice. I'm going to sign off on your monthly form and we're done. And write a few notes. Does that provide adequate supervision? We do not believe that that's the case. We think much more is needed, which is why we follow our model for the supervisor that will supervise you, but this is a chicken and egg question, and it's going to take time for this to all be put into place. So it's going to take a few years. So there's no immediate fix, Josh, but in time there will be a fix, or at least you can seek out under experience and the supervisors that they say. But in the meantime, we want to set standards. And now we're seeing, just by analogy, that ABA agencies have to get accredited or licensed to practice as ABA providers and the insurance. We're seeing this come up. Why? Because the ABA agencies are very loose, using solid or sound behavior policies and procedures, use approaches, not conceptually systematic and not evidence-based behavior methodology to incorporate methodology, more time, sensory integration, and so on and so on. And I see this happen. So now we have accreditation from licensing agencies themselves. This for supervisors. That's a first step in the problem to see this happen in supervisors, but not. So we really want to get there, and we want to get this, model and have supervisors train in it, become competent as supervisors, trainees, so that things like Josh in your scenario could come up much better prepared to deal with various complex cases, work with families, work with agencies, and funders, providers, and the entire team, and provide an effective intervention, especially in complex, difficult cases that don't know that they're getting right now in their supervisor experience at all. It's just left low key, low ball, under the table. Let's get through this and get you your knowledge and get your certification and you're right there. And that's what we're trying to put it. Let's say an end to that and a start to more competence all around, top to bottom. Started with the super, goes downhill, starts at the top. You don't fix it at the top. It's never going to run down to the other buttons. That's long story. Anybody else who wants to chime in, please do.
Well, I mean, in discussions with Mike about in my own work in forensics, and I get messages pretty frequently about those that want to be behavior analysts, but be in forensic criminal justice. And of course, the number one question is, where do I get supervision? And in this day and age, for all these specialties, there's numerous. The Association for Behavior Analysis International, they have these SIGs, these special interest groups. There's numerous dozens of different groups, dozens of different specialties. Where do they get the supervision? And with modern technology, do we have that opportunity now? Could we have a rotation like they do in medical school, where you could be supervised in this specialty and that specialty? So to get a comprehensive or to get a well-rounded set of supervisory experiences that you can add to. So it's not, otherwise it does turn into, I worked at the state psychiatric hospital. Really, in order to get the BCBA, I kind of had to leave there to work at a facility that had a BCBA supervisor. Otherwise, it becomes very cost prohibitive for a lot of people to just pay for their supervision, and time prohibitive. When are they going to do it? They have to do it in their job. Where's the opportunity to do this? And I hope that technology will allow that, and then a set of standards and trainings that will facilitate that really quality supervision in the specializations that people want to have, so that they can then carry it forward in their careers and become supervisors themselves when the time comes.
Yeah, I'm agree with both of you, and I would suggest to someone who is in the same condition to first let's try to map your competency, because when you become a behavior analyst, maybe, and you have just one supervisor. It's like you create your own world where you are sure to work in that way with that procedure. So it's easier to follow like clients with similar profile instead of expand your expertise. So this is my experience. I have a background in behavior analysis. My PhD is in behavior analysis and analysis, and I am also a licensed in psychology in my country and neuropsychology, but I have also a doctor degree in law and neuroscience. So my educational background helped when I start working, for instance, in prison setting, because I had like 5, 6 years of educational training in law, in forensic, and but it was not limited to this. I looked at some behavior analyst already working in the field to help me, got me bringing all together. So that was a great match, because sometimes you have to seek interdisciplinary perspective from others, and also in adult setting, because of I worked for years in psychiatric hospital and setting, and right now as well I'm having a role of not leader but guiding a group of public health system, working with adults with so complex behavior that I still feel like I need to look at some colleague to compare, to talk, to reflect with. There's no limited of time where you can look at someone else that can add something to your expertise. So I think this is the biggest thing. Someone can think that, okay, you certify, you work for 5 years, and you're done. You are able to work in any condition. You can just training yourself. But the power of having colleague to work with, to compare your ideas, to reflect on, and to build more competencies is the biggest thing I always look for in my own practice. So.
And I know I'm a little late doing this, but I really would like for you guys to shout out where you're from to really give our listeners an idea of who's talking to us right now. And I'm going somewhere with this question. So I'll just start with myself. I'm calling from St. Louis, Missouri.
I'm here in northern Indiana, where I live.
Oh,
And well, I currently reside in Florida, but I've worked in states for many years. So in Massachusetts, Connecticut, but also California. Part of my license
I
in
am
analysis, Connecticut and Massachusetts as well.
I am from Italy, southern Italy. My clinic is based on Salerno. So, but I go back and forth from Italy to US.
yeah. So I bring that up because with our listeners, some people go beyond working in their state, right? Some people go and venture to another state when they become a BCBA. Some even leave the country. So I guess when it comes to somebody deciding to expand beyond where they are, I'm really curious to know what suggestions do you have for that BCBA who wants to go outside of where they are, right? Like, I was born and raised in this state. I want to see something different. So I'm going to another country or I'm going to another state. And of course, with that being said, right, you have to understand that it's more than you just taking a job. You have to understand the laws, you have to understand the policies. Then you have to understand not only the state or the country's law, but also too the organizational expectations. Like it's so much into it than just I'm just taking another job or I'm just starting my own practice. So I guess my question to you guys is when you have that BCBA who wants to go outside of where they are, like what advice would you give them? Um, when it comes to them just venturing out and then also seeking that mentorship so they can really learn how to do their job effectively.
Well, Shanda, I think you said it there about for just BCBAs to know the laws, the licensing requirements, and the reciprocity between
Mm.
states. And I can't speak to that except from my own experience I'm also a licensed counselor. I'm licensed in 2 states. And I was, and I mentioned earlier about technology. I'm hearkening back to the COVID days when we were being called upon to serve counseling across many states and in some cases to different countries.
Oh,
And
wow.
then shortly after that, people were saying, "Hey, whoa, whoa, whoa! What are the ethical requirements? Can
Mm.
you charge for services in these other states or across the state?" They've made some headway on that to get a kind of a licensure for counseling that could cross several states. For me, I lived in Michigan for a little while, and that enabled me to get a license there. I kept the active license, and I still have the one in Indiana. So I could have no problem serving online counseling services in both states. But that is just that's something that by happenstance occurred to me going forward in your career. Where are you going to be? What qualifications do you need? The licensing laws are not the same for counseling or BCBA from state to state. The reciprocity between states needs to be understood. And then, of course, what are you going to do what kind of population are you going to serve when you're there? That's a big part of what we're talking about is your scope of competence that you're trying to build up. So that's the legal and ethical and the licensing laws you need to become very aware of. That would be number one.
I
And
can tell you
psychology.
something about. Oh, okay. You can keep going, Mike.
Yeah, well, no, yeah, because I think we really, because we're questioned for you to speak about what's going on in Italy and perhaps even Europe, I think would be very important here. And because now we understand a new organization. It's called International Behavioral Analytics Credentialing Organization that I'm seeing. And I think you're involved with it. I don't know, but you might be able to help us understand that.
Yeah, I can tell you that I personally receive a lot of requests from behavior analysts outside of my country, want to come here in Italy and work as behavior analyst. The biggest problem is the legal framework. So as Tim said, there's no recognition for behavior analysts in Italy, no formal. There's no licensing. There's no. There are a master degree. There are big association, and right now we are in an historical moment in Italy in which one of the biggest association that recognize behavior analysis in Italy signed an agreement with the International Behavior Analysis Organization, that is the organization who certify credentiality outside of US, because right now we have the problem that no BCBA are outside of US. So IBO trying to reestablish credentiality around the world. And fortunately, we set up an agreement between Italy and IBO to recognize international behavior analysts, but people in Italy, for instance, should follow the legal framework. That means if you are not a licensed psychologist, psychology in Italy, for instance, you can work even you are a licensed, you are an international behavior analyst, you need the license in psychology as well to work in rehabilitation system, hospital setting or educational setting. You need a legal degree recognized in Italy and the credentiality as behavior analyst. So we are under this legal framework, and I know because I support several population outside of my country. I work internationally, I try to support people around world when it's possible, when it's under my competency. There are so many different legal framework, and it's not just cultural responsiveness. The problem is that you need to compare your educational background, your licensing with the legal framework of that state. That was the same thing that I did, for instance, to apply to my PhD in US. I should do several steps to verify that my degree in Italy was recognized in another educational system. So it's like this.
So it all boils down to know where you're going to go to, and then wherever you decide to go to, just do your research on the laws, um, where you're going to, because by you knowing those laws, and it actually is a part of our ethics code, to be honest with you, you need to be familiar of the laws of the city or state you're in. But it sounds like when it comes to overseas, you have the IBAO, which is International Behavior Analysis Organization, who oversees that particular sector. But depending on what country you're in, they have their own laws. Because what you're saying is with Italy, you don't even need your license. You just need to show, hey, I got a master's degree in behavior analyst. I have the educational background. So that's interesting because I know that even myself, I never practiced outside the country, but I had an opportunity to practice in St. Croix, the Virgin Islands, which is a part of the United States. But just so happened when I came on board, the agency that I was supposed to work with, they made sure all those logistics were taken care of before I started. So if you do see yourself being a little adventurous, typically if you do decide to work for someone, they normally have all those details worked out because legally you can't just work under them if those things aren't figured out anyway. So yes, yes, yes,
Just to
yes.
be clear, if you go to any other country, the BACB rules and that they don't apply anyway.
Yes.
If you're a kid, you should be CBA.
So the
That's
United
why there's
States,
IBAO, another one that's large in Europe, especially India and to other places, QABA. Other organization that's provincial capabilities as well. So there's two IBAO.
so it's like, so if you do go overseas, it's just figuring out the logistics behind what does that BCBA oversight look like. That's what you're saying. And then
No,
you just follow those.
no BCBA oversight in Europe. Doesn't exist.
Okay. That's
No,
just a United States thing.
just US.
Okay.
Mhm.
Okay.
There
All
was
right.
there was a time when BCBA was they were looking at overseas and then they reevaluated that and made the
Well,
BCBA
there's a reason for that. I don't want to get into it.
right. But as it stands now, BCBA is for the United
Just
States.
US only.
Yeah, the US only. The other
It
kinds of
just shut out
certificates.
Canada, it's just shut down. It was Alberta and provinces just shut down. BCBA as well.
Mhm.
Uh, beyond that, it's really England is gone, Australia is gone. So IBAO and QABA. QABA is accredited to provide, behavioral credentialing overseas. The IBAO is
Mhm.
Okay. All
not
right.
here, so
So
people aren't misunderstand and think,
Yeah.
oh, I did not be a credential I'm good to go. Not necessarily.
And
If
I
you're not
appreciate
accredited, you're not
providing
accredited,
clarity on that.
you have to work on. But it's something to be cautious about. I think sure it's, truthful information, present the theater so that your listeners want to misunderstand this information. Get into it. Sure.
Yes. And I do have enough time for one question. I'm really excited about this. Part one discuss wellness plans, self care, behavioral activation, organizational pressures, and the heavy emphasis some agency places on billable hours. At what point does burnout stop being the individual self care issue and become an organizational systems problem? And what responsibilities do supervisors and organizational leaders have to change those contingencies? And I bring that up because I initially started this discussion with by 2030, how the abundance of resources in adult services should be around that time. So, in case you don't understand the systems aspect, normally when there's a huge need like that, businesses come out the woodwork trying to fulfill the need. And then with a lot of these businesses, sometimes they get competitive, and with the competitiveness, it creates a domino effect where it affects your team, where maybe you have certain expectations on work performance, or maybe everybody needs to have a certain amount of people in their caseload. So then it kind of starts to shift away more so from making sure the whole team is supported, right? But it's more so, let's make sure we help the needs of our clients, not realizing that your team is the driving force that helps you with the clients day to day. So I'm really curious to know, like I said, even though we have wellness plans, self care, behavior activation, things of that nature, but what can we do when that burnout stops just being an individual self-care issue, but we notice, okay, this is more of an organizational issue? So how can we change some of those contingencies?
Well, I can only speak from experience in different settings in inpatient state care and counseling in the community and behavior analytic work. I mean, the it's right from the get-go, it's an issue, and the turnover, which is very expensive for companies to lose staff and then have to bring in new and then train them and have them become accustomed. Just that whole process ends up being a very costly and probably affects a lot of the value of the clinical work that's being done. But I do see more and more we're seeing the uh, areas that provide mental health and behavior analytic services. They're very much by the numbers. So many clients, so many hours logged in, and so much in terms of if they're receiving grants or government.
No, Timothy, no. I think we
Once
lost you,
again,
Timothy.
Oh, there you are. Back.
There it goes.
checking the boxes, just like the old that we're doing all these tasks that we're supposed to do, which are important, but that becomes more the job than the actual clinical work and creativity and all the things that we may have set out to do. So it's a perhaps a perennial problem, but I do see a lot of it in all the different settings I've worked at.
So I think, right now we're seeing a lot of this burnout, the current structure in aviation services. So I'm speaking words as well, as a psychologist as well. I would feel very good for this analysis, uh, but I've done work as a psychologist in behavior organizations for diagnostics. But the pressure is always on. Right now, the issue seems to be that these things who are arguing venture capitalists coming in who don't know our field, buying up the ABA agencies, the pressure on the billing, was sacrificing quality services for, say, the building and making it profitable for venture capitalists. There is an argument that it's going to kill our industry or reduce it dramatically. Some say it's a drip to a drip, slowly moving. This thing is happening more rapidly. I haven't seen any of it come true just yet, but it may happen. And the thing is that as we do move on for the need for more services, the first issue is just that the right to be a lot more final reputation for the one that came through when 35, 30 years ago I saw it was providing health services for children in adults. They just milked the system. So they got caught with Medicaid fund shut down nationally all at once. And that was a scary situation. What will happen is there will be more private providers if they can figure out where the money's going to come from. That's the key right now. Not know where that money will come from. There might be government funding, might be Medicaid funding, insurance, not so much. And it doesn't really work so well. Private insurance, but if they find a way to get paid for, those venture capitalists will be there as well. Put pressure on, for money's sake. So after these, I see more analysts needing to take over the organizations and
So
not selling out.
I have a question, because it sounds like you got the direct level and the systems level, right? Direct level is I'm out there in the field, I own my own business. And the systems level is where laws, policies come into change. So when it comes to changing this work culture of minimizing burnout, do you think it's a systematic issue where maybe the behavior, and I might be ruffling a few feathers, it's okay, it's Tuesday, it's Shonda. But anyway, with that being said, do you think the board, the ethics of the BACB should set that standard and that criterion to minimize burnout? Or do you think it's more of a legal thing where, like you said, depending on your funding source, typically determines how that organization operates? So is it more of a systems things where now we have to advocate for certain laws and policies in the mental health field so we can minimize that burnout? Like, where should that incentive come
All right.
from?
Okay. First of all, the BACB has no legal authority for any of these issues. They can tell behavior analysts how to function ethically. That's okay. However, when it comes to business, we have no legal authority to do anything. They can't
Oh,
do
wow.
policy. No, they can't. Listen, I teach the ethics course in my program. Teach the ethics, but BACB, putting out dictate policy. They can't tell a private agency what the policies and procedures are to be. And they can't dictate what's going to happen. This is, as you said, it's a systems issue. Okay. Those of us in the field are doing the work throughout professional organizations, ABAI, our state chapters, so on, to help do our best to ensure and work with legislators to ensure that there are policies and laws in place that will help to ensure services are happening, and that these folks who are coming in and taking over now field interested just on dollar and services. So that has happened at the BACB across already happened. They can't, but right now we do have that ethics guys to create behavior analysts that should behave ethically. But it doesn't tell you they can't make money in the business. That. So that's where it does become a system issue. So we just have to keep pushing this, fighting this fight, get involved. I'm involved with BBA right now, for example, and that was lots of other professional organizations and legislators that we sure as we can to advocate for our professional organizations. learn how to do that. We didn't know something that either. You know, we don't know how to advocate very well and work with critical legal systems. We need definitely the assistance with that also to do it, but it's definitely an assistance to keep those folks out, make sure the you know, organizational management, again, an OBN person come in and help out with the management, how the organization runs. We need people are good at what they do, with the really great ones, and it can advise the organization and also help business business matters, preventing take over by you know, folks who just are interested in money, you know, focusing on client care for the huge systems issue that we're absolutely ready. I don't think OBM can offer some assistance with
Yeah.
behavior analysts, figure out work with systems.
Yeah.
Because they can come in as consultants. You know,
Yes. And we don't realize it, but right now we're planting the seeds for future generations. So yes, we might not make an impact now, but I wouldn't be surprised 10 years down the road, BCBAs start to work differently, where when it comes to their CEO, their business, they're making sure that it's other BCBAs who do have that business smarts or whatever, as opposed to someone who's just business minded running an ABA organization.
yeah, yeah,
They're not familiar with our ethics code, but they know the business aspect in and out.
right.
So
I
we're
mean,
definitely planting the seed for change.
yeah, you
Now,
know, there are a few out there who are who have to keep
yes, they're
both
out there.
arenas, you know, the BCBAs have their heart in the right place and also have business savvy to put it together. That's, I think, too far and too between.
Yeah, we're getting there.
Maybe the business course is probably the ABA program.
Yeah, yeah, I wouldn't be
As a thought,
surprised.
right?
Yeah.
I think that would be a great thing.
A little bit of industrial psychology
Well,
as a part of the
yeah,
curriculum.
or we can call it OBM,
OBM,
business
yeah.
savvy and business,
Yes.
sure, to keep it behavioral. Well,
Yeah, so you hear that, future BCBAs? Advocate for either you create or you advocate for a curriculum that incorporates that OBM and then also that business side. And what was the fancy word you used, Timothy? That was beyond business.
Well, just from psychology, we would say industrial psychology, which is more
industrial
general,
organizational
industrial
psychology, which is
organizational.
the broader scope
Yeah,
of which
broader.
OBM fall.
Yeah.
yes, yes, yes. All right. Well, we're going to wrap up. Does anybody, I would love to hear from everyone, anything you want to give our listeners, those future BCBAs who are listening to this right now? What advice do you have for them in response to the topic, comprehensive supervision, or just something you feel like they just need to know?
I would, I think, become aware of the field, not just of your ability as a practitioner. Become aware of what's going on in the field. If you are going to supervise RBTs, there's a lot going on there. There's a lot of discussion about registered behavior technicians and their concerns and burnout and then the industries. I'm I'm blanking on the term, but when you have a larger organization ends up financially, private equity becomes relevant for a particular company. Just to find out what's going on in the field, and like we said, the laws, the licensure, it becomes part of your responsibility to become more aware of these things as you go forward in your career.
Oh, I love that. I love that so much because when you know more about the field itself, you know, one thing I can say, if you know what your values and morals are as an individual and you learn the field itself, you know how to navigate the field. So if you're learning, okay, with adult services, this is happening, or like you said, well, RBTs, this is happening, and then you apply for a job and you see an organization is contradicting everything you've learned so far. It's like, should I go there? So that's good, as opposed to just being book smart and then just putting yourself in a bad situation due to you just being hungry to work somewhere, or possibly start your own business, because even starting your own business, you need to learn these small nuances, right? So that was great advice. All right.
Yeah, I'm agree. It's a really great things. I would say just to follow your suggestion to map your competency and also your gaps, diversify your mentors, look at everyone. Everyone can give you something more. The value that you can share is the value that you accept from others. So seek perspective, learn how to organize organization as well as you as individual, and develop any area of expertise that reflects both your behavioral training but also your broader professional background, and remain cultural responsive, protect autonomy of the person, and ask yourself what is meaningful for that person. That's the biggest things that sometimes we don't keep in mind enough. So don't try to create like professional identity so rigid, but try to expand yourself as much as you can.
Yes. And I love the fact that you said find additional mentors. I'm going to be honest. When I came into this as a BCBA, I was having another BCBA assist me with supervising these students. And I'm going to be honest, as a human, I felt some kind of way. I'm like, whoa, they're contradicting what I'm telling them, and this, that, the third. But then I had to humble myself and realize, well, Shanda, you're not right, and they're not wrong. This is an opportunity for you to learn just like your students learning, so you can broaden your scope. Or if it's something beyond your capacity, you can refer them to this BCBA. So I know sometimes as BCBAs, specifically in leadership, we just want to supervise that person. We want to streamline what they get and what they don't get. But you have to understand that you want that well-rounded BCBA. We don't want the Joshua example where he's had one BCBA. Now he has 8 individuals and 7 RBTs, and he can't even manage it because he's only had one clinical lens on how to do his job effectively. So you have to be open to encouraging your students to seek out mentorship elsewhere. And if you have to, you allow those other mentors to be in the room with you so you can learn just like your students are learning. So yes, I love that. What did you say? Identity. What did you say? You said something identity.
Yeah, your personal and professional identity built up, yeah, based on the value that you share with others as well.
Yes, yes, I love that. I want to ask you something real quick, Valerie. That I'm gonna take it to Mike. What is your personal professional identity? How would you describe it in one word?
Oh, it's like extension. One word is extension. Because I think that we have to go beyond our security place, beyond our security population knowledgement. You have to extend yourself through other, because the science is applied to, we start seeing this, we can apply we can change the life so many people. I'm now working on a very big project. It's based on AI, so we are in team. We are looking how to extend the life of the person. So extension is
Okay,
my word.
I like that. Yeah. All right. I'm sorry about that. I got sidetracked. That was my squirrel moment. I seen a squirrel and I got distracted. But anyway, with that being said, so Mike, what are your thoughts? What do you want to leave to our listeners?
So I'd say definitely expand your horizon as much as you can. Seek out other mentors, even if it's with the same population you're interested in, but also try to talk about other populations as well. Speaking of others, specialty areas. Right now, we're hearing buzz about calling micro specialty credentials, and if you want to be able to work in some specialty area like treating apps, something like the adolescent issue, adult issue, in the childhood, go seek out mentors and find experts in that field, some knowledgeable who you know about or has published a lot of clinic. Um, Try to see if that would make them move on and but I think this will help you going forward because I think it's the way future in psychology has for 3 or decades we get 7 subspecializations certifications. It's psychology beyond just the license. It's we're seeing this come up now in analysis. Big issue maybe AI and other areas. So that's one thing. Expand your horizon. The other is get involved. So once you find the center, who you are, what you are, then get involved because the only way we're going to shape and control our field is we do it. If not, someone else will do it for us and frankly to us. And that's what we're seeing happen now. So I mean, I've always been active in professional organization for many decades. I'm some practice board, president chapter, started a chapter, all those kind of but whatever it is you find, maybe be part of the special interest group with ABAI, get involved with local state chapter or some other aspect, get involved in management, future of field behavior analysis, so get initiated. That's because if not, they say someone else will for us who has no idea who we are, what we do, we'll end up with something we don't want, we don't like. It's on the field, even mostly for our clients now. It's happened in New York. It's an unusual licensing lobbying for Poland. I'm talking about that because I'm cannot be controlled, with instance and some other instance as well. That's just saying it's a very unusual situation. But get involved. Now we must learn how to do advocacy, learn how to become net so on. In other words, people that aren't carrying being able to go out and speak to politicians, be involved in court cases and for witness and other kinds of issues and speaking to legislators to defend and help them up. That's going to be a big help.
All I can say, Mike, is you got me riled up. I'm gonna have to go out there, get me a few picket signs, get involved.
Get out there.
You're
Get out
right,
there.
though. You can't sit there and be like, oh,
Yeah.
I want change, I want change, I
Yeah.
want
And
change.
I practice what I preach. Practice what I preach because I've been involved and still am.
Yeah.
Yeah.
And like nothing against social media. It's not because I know we live in a digital age, but you have to utilize the digital age for your advantage. You got to understand with the digital age, you can reach out to anybody and everybody around the world.
Oh, yeah.
So don't just use it to just like a comment or to make a comment, oh, this needs to change. Like use that platform to really drive change, whether you're doing a YouTube or, just something just to drive change, to plant that seed. Because even if you don't water that seed, somebody out there is going to be inspired and to drive that change even further. So yes, I like how you just emphasize being involved, what that looks like. SIG, subject. What did you say? SIG is the acronym for
Is it special interest groups?
special interest group.
SIG.
Thank you.
SIG.
Thank you.
Yeah.
I was
SIG.
getting stuck.
Yeah.
SIG.
Yeah. I
Yes.
mean, when we saw 20 years ago, psychology tried to take over the field of behavior analysis by saying you can't practice it unless you're a licensed psychologist. And they also tried to take over school psychology as well at the time. They put out a statement time for school psychologists saying, well, we're going to try, we're going to sue you. My answer for behavior analysis was we need to write now. There was no licensing yet at the time. So I went out with some colleagues and we wrote colleague of ours who's co-author of this book, Joe Tilly. He and I, we just got together and wrote the first licensing, among the first licensing bills to counter what APA was trying to do 20 years ago. And that was passed in Pennsylvania. It was one of the first licensing bills that APA was passed in this country. We got it passed in 2011, Pennsylvania. And so, and then I went on another states as well. And it was a matter of us taking control of our field so that others would take control of us. Because if APA took it over, we wouldn't be sitting here today talking about this. So, and the other thing is, read the book. Get the book with it.
Yes, yes, yes. And the book is titled Comprehensive Behavior Analytics Supervision. Well, Mike, all I can say, you got me riled up. I feel like I want to do a rally or something. I don't know. You got me all empowered.
All
No,
right,
but
there you go.
seriously, but
That's what
that's
you
what
got
we're
to do.
supposed to do, right? But with that being said, I want to thank Mike for being here, Timothy, Valerie. I just appreciate you guys so much. I'm smiling so hard. I think my jaws hurt at this point. But if you case, are you okay with our followers following you on social media? Are you guys comfortable with that?
Sure. Yeah.
Okay. All
Yeah.
right.
Thank you for having us. This was
Yeah.
great. We
Yeah.
love
Yeah,
being
really,
here.
thank you.
This
Yeah.
is great.
Yes, yeah. And I feel like we kind of got the best of both worlds because everybody's from everywhere, all different experiences. We got you, Miss Valerie, over there in Italy. Like we just hit every area today. Like it wasn't just like Shanda talking to somebody else from Missouri. Not that there's anything wrong with that, but I just felt like expansion, right? We're just really tackling all things in all areas. So yes, well, thank you so much.
Thank you.
Continue to follow Shanda J, your BCBA, and I'll catch you guys next time.
Okay.
Bye now.
Okay, bye.
Bye-bye.
Thank you, Shanda.
Thank
All
you.
right, yes, we are live. If you want to see the video, you're more than welcome to. Normally, I do send a survey.